Well, make no broken vertebrae about it. It's time now for Better Pets.
And we're talking about when our pets start slowing down, and oftentimes it's because they're aging. We think, well, that's just how it has to be.
Yeah.
You're getting older.
No, but there are things that your veterinarian may be able to do for your cat or your dog to ease aches and pains and get them up and moving again.
Our Better Vet, Dr. Andrea Dennis, is here to fill us in. So it's just like humans. We shouldn't accept it with ourselves that, oh, we're just getting old. This is how it has to be. Right. So pets also, we can do things for their pain.
Yeah, I would say once a year, twice a year. Usually we have our animals come in for their usual exam, and when we ask, well, how are they doing? How are they feeling? Well, you know, they're getting older, and they're getting old, so this is why we see this and see that. And I'm like, well, that's not usually the case.
Right.
It's not usually the age. If it is something, which is one of the most common things that we see is osteoarthritis, then there is a reason why that is happening and why they're having difficulty rising. So we can fix these type of things. We can make sure we can at least keep them much more comfortable than what people are willing or think they need to accept just because they're getting older.
Okay. Are we talking acupuncture? What are we talking?
Yeah, all sorts of things. The first thing is, how do you even know that there's a problem? Okay, things like, you know, having difficulty jumping into the car for a dog.
Right.
For cats, many times it is a matter of, I'm not making the litter box, and we've talked about litter box issues too, but when a cat is much older,
half in, half out, that kind of stuff could be arthritis?
Yes, or sometimes people have it down in the basement, and who wants to go down in the basement if your hips hurt all the time?
That's why I have a litter box on every floor of my house.
And that's the best way to do it, because you just never know. So I think the other thing too is sometimes they go for a walk and they don't go as far as they used to. These are dogs.
Both of my, really? Because both of my cats are doing that too.
See, that's part of the aging process.
Difficulty climbing stairs, rising from when they're resting.
So those are some of those typical things that we do tend to see with dogs, and mostly dogs than cats.
Okay.
So if we can sort of recognize those things, then it's a matter of, let's talk about, you know, sometimes some dogs will get like a sore on their joint because they lick it all the time. That's a sign that hurts. So we can do lots and lots to help that out.
Okay.
So one of the first things that I like to do is actually make sure the exercise is proper. Don't take your 12-year-old dog for a
jog,
an intense run for 2 miles and expect them to keep up. You don't want to stop the exercise either. So if you can do exercise, really smart exercise, like swimming is the best. There is nothing like doing some good swimming. If you want to go ahead and make sure that they have like sort of a little light jog, that also works very well.
Well, what is a nutraceutical?
Well,
I think we need those.
I know. What the heck is that?
Nutraceuticals are not drugs. Have you heard of glucosamine?
Yeah.
Yeah, that's a nutraceutical.
Okay.
So glucosamine, chondroitin sulfate, those are not drugs, and my dog is on them. And my dog is only 6 years old, but he actually had an ACL tear. And because of that, he has a lot of irritation, and he's prone to arthritis in that knee. So what the nutraceuticals do, and I've got one for cats actually right here, and that's called Dosequin, and what that does, it just helps the cartilage stay healthy. It reduces inflammation, and it's not a drug. So that's something that I recommend people start their animals on earlier rather than later.
Like what age?
Well, if they have a problem, like my dog at 6, I'm starting him right away.
Okay.
But most of the time, I would say 7 to 8 to 9
and
is probably problems.
Pills, so you have to figure out how to
Well, in cats, what's nice, that one is a capsule. It's fish flavor. You open it up and you sprinkle it right on there.
Oh, that's great.
And I think I would definitely start with cats at around 10 years old. So.
What about medicinal marijuana? Should we be hooking up our dogs and cats
You know what?
to
pot? We're gonna have a show on that.
No, you're kidding.
No,
I was just doing that as a joke.
Topics.
Literally, it was just a joke.
No, that's another piece of it. But no, there is there's 2 issues, but we'll talk about that. I got a whole show for that one.
You've got some other things to talk about. There's some injectables, there's acupuncture. I know acupuncture is huge for pets now.
It is, and it's not my first thing that I recommend people go to, but if they have gone through some of the other issues, like using the nutraceuticals, if they've practice some weight control. You do not want your animals to be overweight. That's very, very important. So weight reduction, and we've talked about that. If you've got a dog that's 10 pounds overweight or a cat that's 2 pounds overweight, it's very difficult for these joints to actually work. So that along with, you know, again, making sure that we have the nutraceuticals, good exercise, and then also, too, if we can massage your animals. Home massage, physical therapy can really, really help.
Do you just massage them, like, just by by petting them? Are you supposed to use an oil or?
No, you don't need an oil. We don't need an oil. But just massaging the muscles.
Taking my dog to Massage Envy right after the show.
No, just actually massaging the muscles, you know, above the knee, below the knee, the hip area, because that increases the blood flow to the area, and that can be very, very helpful.
We got about a minute, so we want to make sure we
All right, so one of the things is a lot of people, you know, as they worry about giving their animals too many pills. And I always say, and this is just to sort of identify, we have a little pill pocket here that sort of holds all your medicines. And for us to do medication on a daily basis is not too much for your animals, especially as they get older.
You hide it in food and do things like that?
Yeah, or some people hide it in peanut butter. They make these little things called pill pockets.
Okay.
And then really NSAIDs is another big piece of controlling osteoarthritis. NSAIDs are like, but you cannot use human NSAIDs. You can't use ibuprofen. You can't use aspirin. One Tylenol will actually kill a cat.
Seriously?
Yes, one Tylenol. So that's why with dogs, you know, and I've got one right here, got a couple. We've got Deramax and Carprofen, and those are really excellent anti-inflammatories, NSAIDs for dogs. Please, please do not go into your medicine cabinet and actually take something out.
Well, good to know. Thank you so much, Dr. Dennis.
You're very welcome.
All right, as a reminder, Dr. Dennis is the owner of the Bloomfield Animal Hospital on Old Windsor Road in Bloomfield.
And on alternating Saturday afternoons from 2 to 3, she's taking your listener questions during Pet Talk on WTIC 1080, so tune in if you can.
All right, there are